So the ALCYONE trial is a study in newly diagnosed multiple myeloma patients who are not eligible for stem cell transplantation. And this was a study that looked at incorporating daratumumab into the melphalan bortezomib prednisone backbone. So bortezomib with melphalan and prednisone is a frontline therapy for transplant-ineligible patients that's used in a lot of places around the world, perhaps less so in the United States, but nonetheless it's a very important regimen for newly diagnosed patients throughout the world. So we were very interested in determining whether the addition of daratumumab into the bortezomib melphalan prednisone backbone would improve patient outcomes. So this was a trial where patients received 9 cycles of bortezomib, melphalan, and prednisone with or without daratumumab. And for those patients that were assigned to the daratumumab portion of the trial, they went on to receive daratumumab maintenance therapy every 4 weeks thereafter. This is data that has previously been published in the New England Journal of Medicine, but at ASH 2018, we got to see updated results from that particular trial with longer follow-up. And very impressively, and not surprisingly, the addition of daratumumab to bortezomib, melphalan, and prednisone improved overall response rate. It improved high-quality responses, so there were more very good partial responses, there were more complete responses, there was more achievement of minimal residual disease negativity, and as always, that translated to an improvement in progression-free survival. And that improvement in progression-free survival actually appears to have gotten better as the data have matured. So I think the hazard ratio was 0.45 approximately. So we're looking at a 65% reduction or 55% reduction in the risk of progression or death with the addition of daratumumab. And I think what's interesting about this too, the fact that these patients on the daratumumab arm continue to do so well, supports that you could potentially use daratumumab as a maintenance therapy after initial treatment.